central nervous system issues going on. And I mean abnormal by the way, the quality of the movement, not necessarily is it making them dizzy, because a lot of people with BPV and vestibular neuritis, that kind of thing, they might feel like they're dizzy with tracking, but the movements are smooth, and that's what you're looking for, is their ability to move. So ocular motility, smooth pursuits are kind of incorporated. Some people use them interchangeably, but really what it means is ocular motility, you want to go to their full range of their orbit. So how far can they move their eyes out to the right, left? This is that H. So I'll go through the H. Smooth pursuits is within their comfortable range. So we say 30 degrees to each side, and up and down is the eyes moving smoothly. So I'll go through both of those kind of interchangeably here. So you're going to give them a target. I like to give them the pinpoint of my finger. You don't want to give them the whole finger, because then they might be jumping around between the knuckle and the tip of the finger. So you want to just really give them one little target. If you're using a pen, maybe just the eraser. So you're giving them what you want them to look at, so that you don't see abnormal movements that are really normal. And I'm gonna be about 12 to 18 inches away from her face. You don't want to be in towards her nose so far that she's converging on it. So I'm out here. I'm asking her to keep her head still and follow my finger. And I'm going to make an H pattern. So I'm coming all the way out, up, all the way down, across, up, and down. If they're having a hard time not moving their head, you can put your hand on their chin just to kind of control their head movements, because some of them will start to fall over their head. So that's ocular motility, the whole range of their orbit. Now, smooth pursuits is more, I do more of a T pattern within 30 degrees of their range. So I'm going back and forth, and then up and down. So now you're looking at that smoothness of motion. Are the eyes moving together? Are they following your finger correctly? Abnormal would be they get like a little saccadic jerking while they're going through. They're coming off your finger. They're not able to hold their gaze. Those kind of things. And we will show you. I did pull up a video of an abnormal smooth pursuit.
Gaze holding the smooth pursuit, because they saw that with Kim.
Yep.
Remember the first woman that I said she's beating to the left, and then she looked to the right, she wasn't so bad. Then she went up into upward gaze, and she was beating up. So that you would have picked that up on a smooth pursuit.
So spontaneous nystagmus, you'd look for just looking at the patient. So they're just looking forward. You can give them a piece of paper that's just white, so they cannot focus at all on anything. But just looking at them, if you're seeing a beat or not, that's what spontaneous nystagmus is. I think we listed that on there. Then gaze holding, you want to take them to 30 degrees of each range, and then look at what the nystagmus does there. So if I'm seeing a nystagmus here, I would call that spontaneous nystagmus. You name it to the fast beat. So say she's right beating right here. So if it's a peripheral nervous system problem, if I take her to her right 30 degrees, it should increase, but still be right beating. And then I bring her to her left about 30 degrees, and now it should still be right beating, but a lot less.
So it's still going this way, if it's a peripheral problem.
So that's direction fixed, we call that.
You saw a patient with a central lesion, remember?
So
That's
now
why
I'll do
the
a central,
nystagmus
yeah.
was changing.
So now a central nervous system patient, I'm going to go to the right, and they'll be right beating. I'll go over to the left, I'll hold it there, it'll be left beating. I'll go up, and they could be up beating here. And then you could go down, they could be down beating there. So that's what gaze holding nystagmus is. Spontaneous is just sitting there, you're looking at if they have nystagmus. And then gaze holding is you're giving them a target and now moving them in different parts of their orbit of their eye. You don't want to go to specifically end range, so I don't want to bring her all the way to end range, because a little bit of end range nystagmus is normal. So you wouldn't really want to call that anything if it's just purely in their end range. That's gaze hold, or spontaneous, gaze holding. We went through ocular motility, that's the full range, the H. Smooth pursuits is more that little T, just checking within their comfortable range. Saccades are their ability to move between two targets. And again, if this is abnormal, if they're overshooting or undershooting, or if they're really slowed, and this would be markedly slowed saccades, you're thinking more central nervous system problems here. So here you're going to give them two objects to look at, 2 fingers, a finger and a pen, whatever you want to give them, your nose and a finger. Again, a comfortable distance away. You don't want one to be closer to the eye versus the other, because then you're asking them also to converge as they do a saccade, and you're not just testing a saccade. So here you're asking them just go back and forth between 2 fingers. This is the easiest one for people to do. And you're looking for the smoothness. You're looking for the ability of the eyes to move together. That was the I and O you would catch here you showed them just a little bit ago, where one eye moves slower into a deduction. If you want to make it a little bit harder, you cannot give them 2 objects. You cue them when to look which way, so then they can't use their kind of anticipatory response to just go back and forth between your fingers. You could say, look at my nose, then out to my finger. Nose, finger. Nose, finger. So you're telling them when to do it. It just gives a little bit more processing through the brain. That's the saccades. Stop there.
So,
okay.
So you're going to do sideline, Brandaro, you've got ocular motility, which is